So the medical assistant does have a vital role in assisting and actually conducting the EKG testing. The MA role, first we're going to prepare our patient for the procedure. Now with this, if they haven't had an EKG done before, you might want to give them information as to what to expect. This test is non-invasive. It doesn't cause any pain or any discomfort to the patient. So we would make sure that we answer all of those questions before we proceed. We would also provide post-procedure assistance, which might entail helping the patient remove what's called electrodes from the patient's chest, helping them clean the area, maybe helping them off the examination table. We would accurately perform the testing, note obvious abnormalities. That is something that we will be covering in this lesson, and in the next lesson, we'll be looking at abnormalities on EKGs. Now, abnormalities, of course, if you can detect them, obviously these are results. And remember, with results, it is not within our scope of practice to be able to pass results on to our patients. We would also maintain the equipment, prepare materials for the provider's interpretation, and communicate any further instructions the patient may need. So in preparing the patient, we always start with identifying ourselves. Ensure a pleasant experience by explaining the procedure. Patients do great when they know what to expect. If they haven't had an EKG before, you can go ahead and explain the procedure to them, eliminate any level of discomfort that they may have so that we can move forward. We always identify our patient using our 2 identifiers. We're going to explain that the procedure is painless. It does not send electricity throughout the body. We are not shocking the patient. And the procedure only takes a few moments. Also, when the test is being performed, you want to make sure that your patient understands that they want to eliminate any movement. We might need to take their cell phone away and place that in another location away from the machine so that it doesn't interfere with any of our results. And you may assist the patient with disrobing, gowning, and draping. Always making sure that we maintain the patient's privacy along the way. Now with this, the patient will only have to undress from the waist up, but we do need to have the lower legs accessible. So if they have socks on, we wouldn't have to remove them. We could just roll them down. Now, if they're wearing pantyhose or if they're wearing tights, then yes, those would need to be removed. The drape that we provide the patient with, or the gown, the opening is going to be in the front so that we have accessibility to the patient's chest. And if they're wearing any jewelry, any body jewelry, we're going to ask them to remove that so that it doesn't interfere with our reading, as well as what I mentioned before with the cell phones, have them turned off and placed away from the testing site.